everybody, I'm Hailey Serna and this is my science journal. On last week's episode we talked about BMD, otherwise known as Becker's muscular dystrophy. And on this week's episode we're talking about DMD, which is Duchenne muscular dystrophy. I asked you guys on Twitter to send me your questions with the hashtag DMD so I can answer all these questions for you in this week's episode. Okay, so let's get started. The first question is, what is Duchenne muscular dystrophy? Well, that's a good question to start off our discussion. So basically, what Duchenne muscular dystrophy is, otherwise known as DMD, it is a genetic disorder that is inherited from the parents to the offspring. And to sum it all up in very simple terms, it's basically where as you get older, your muscles get a lot weaker. And DMD, which is part of one of the 9 muscular dystrophies, is probably the most common and also most fatal. For the second question, it is simple. What are the symptoms of Duchenne muscular dystrophy? The symptoms of muscular dystrophy include heart problems, fatigue, tiredness, clumsiness, difficulty in running or jumping or walking, anything that basically involves you moving your muscles. Because again, your muscles are a lot weaker when you are affected with DMD, and so all of the normal things that average people do, it becomes just a lot more difficult. Next question is, what group of people are affected by DMD the most? And this is very simple. It's mostly males. The reason for this is because it is a recessive sex-linked disease, and basically what that means is that the mutation of the gene that causes DMD takes place on the X chromosome. And because women have 2 X chromosomes compared to males that have 1, the male, if they get one of the faulty X chromosomes, then they automatically will be affected by DMD. While on the other hand, women, they have 2, so if one of them is faulty but the other one is normal, since it is a recessive disease, they will only become carriers and not express any symptoms of DMD. Are there any treatments of DMD? Yes, there are many treatments. Unfortunately, there are no cures. These treatments are not as effective. Basically what they do is they allow for people who live with DMD to have a better quality life. Okay, so some treatments include using steroid drugs. This is in order to basically prevent or slow down the loss of muscle. Using albuterol, which is basically just a drug that is used for people who have asthma and things like that. Fish oil, green tea extract. So in the future, people are looking to using stem cells and gene therapy in order to fix DMD and treat DMD. Also, people go to physical and speech therapy. Activity is also encouraged as a treatment. It's always good to become healthy. Lastly, some other treatments include just assisted ventilation, which helps for people to breathe more, as well as using drugs that help with the heart to function properly. And the last one is just using orthopedic appliances, such as braces and wheelchairs and other mechanical things that people with DMD would use to just help make their life easier. The next question is, who passes on the faulty gene? And usually it is the female. As I said probably before within the video, is just that females are the carriers for DMD, meaning that they can hold a chromosome, meaning that one of their X chromosomes can be faulty, but they will not express the disorder. And because of that, it is easier for them to pass on the disease to their offspring. How can this be tested for? There are many ways that DMD can be tested for. Some of these include going to the hospital and doctor's office to have a full nervous system exam, and basically here your heart, your muscle, and your brain are tested, and from this exam you can find out anything that's abnormal within your body will show and overall lead to the conclusion whether you have DMD or not. Other tests include EMG, otherwise known as electromyography. Basically, it checks the health of your nerves as well as your muscles. And so from there, you can your doctors will conclude whether you have DMD or not. You can also just take simple genetic tests, muscle biopsies, as well check for serum CPK. And basically, serum CPK is an enzyme in your body that is located in your heart, brain, and skeletal muscles. And checking for this will help determine whether you have DMD or not. So these are the different tests that you can take in order to see if you have DMD or if you are a carrier. Does DMD cause pain? This I found was a very interesting question due to the fact that it sounds like it'd be very painful if your muscles are very weak and it's very hard for you to just do simple basic tasks. But after researching, fortunately, it's really not that painful. They do get muscle cramps, people who have DMD, but these muscle cramps can easily be fixed by just getting over-the-counter medicine, things that any normal person would do. So it's a lot less painful than I guess I would expect. How likely is it for a female to get this disease compared to a male? It is a lot less likely for that to happen just because they do have 2 chromosomes, so if one of them is faulty and the other isn't, then they will just become a carrier and not show symptoms and not have to experience DMD. While on the other hand, guys just have 1 X chromosome, so if that is faulty, then it's kind of bad luck for them and they will show the symptoms and express DMD. This next question is actually more of a personal question, and it's asking, my friend Sasha is a carrier for DMD. If her husband and her had a child, how likely is it for their kids to have DMD? This could be solved by just using a simple Punnett square. After doing the little Punnett square, 25% chance that their kid will express DMD. Also 25% shot that one of their kids will be a carrier. So that's just like a little information. Using Punnett squares can just allow you to find out more about, I guess, what will happen if 2 people mate and what their offspring will be like. The cause of this disease is overall just a lack of dystrophin, and the reason why people may lack this protein is because there will be mutation on the X chromosome, which will lead to people lacking dystrophin. Dystrophin is just a protein, and it really helps with the stability of muscle tissue. So, I'm sorry guys for just having really bad quality right now, but for some reason my camera died right at the ending, and I thought I got the footage of my outro, but I didn't. So I just wanted to say thank you all for watching. I hope you all enjoyed, and I will see you next week when we talk about the nervous system. And that's a wrap for today's episode. Thank you for watching.